this on.
Good afternoon, everyone. The February 28th, 2023 meeting of the Human Services Committee will now come to order. Will the clerk please call the roll?
Mr. Blankley. Here. Mr. Blankley is present. Mr. Brew. Here. Mr. Brew is present. Mr. Ovecchio Hoffman is excused. Mr. Dondorfer. Here. Mr. Dondorfer is present. Ms. Hasman. Here. Ms. Hasman is present. Chairman Keller.
Here.
Chairman Keller is present. Mr. Morris.
Here.
Mr. Morris is present. Ms. Smith.
Here.
Ms. Smith is present. Mr. Udelson.
Here.
Mr. Udelson is present.
Is there anyone signed up for the public forum?
There is not.
Is there anyone present who is not signed up to speak who would like to address the committee at this time? The next item on the agenda is the approval of minutes. You have the January 24, 2023 minutes before you. They will stand approved unless the clerk is notified of any changes by the end of the day. The next item on the agenda is new business. Mr. Clerk.
Referral 23-0036, authorize a contract with P. Miller Ashman to provide urology services for Monroe Community Hospital.
Moved by Legislator Smith, seconded by Legislator Dondorfer. Are there any questions? Legislator Smith.
% increase in this contract.
Through the chair, it's related to an increase in cost of services.
Thank you.
Any further discussion? Hearing none, all those in favor, please signify by saying aye. Aye. Are there any opposed? Item carries. Next item.
Referral 23-0037, acceptance of a grant from the New York State Office for the Aging and authorization to contract with Lifespan of Greater Rochester for year 3 of 2020 through 2023 Lifespan Respite Care Program.
Moved by Legislator Dondorfer, seconded by Legislator Morris. Is there any discussion? Legislator Dondorfer.
Mr. Chairman, to the administration, do you plan on continuing this program after the expiration of this grant?
Through the chair, can you repeat the question, please?
Through the chair to the administration, do you plan on continuing this program after the expiration of the grant?
Is this the MIPA program we're talking about or the respite?
This is the New York State Office of the Aging and authorizing contract with Lifespan for the respite care.
Yes.
Yes, you are planning on?
Yes.
Okay. And through the chair to the administration, the other $26,000 from the grant, is that in case there's an overrun of the targeted hours like there was last year?
Yeah, there was a carryover from last year. I'm not clear on your question. Could you repeat that? Through the chair, I'm sorry.
Okay. Through the chair to the administration, where is the other $26,000 for this going from this grant? Is that in case there's an overrun of the targeted hours like there was last year?
Yeah, those are personnel services. We also have a program monitor that monitors the program from the Office for the Aging.
Okay. And that's where the extra $26,000 is going?
Through the chair, yes.
Thank you. I have no further questions.
All right, thank you. Is there any further discussion? Hearing none, all those in favor, please signify by saying aye. Aye. Are there any opposed? Item carries. Next item, please.
Referral number 23-0038, acceptance of funding from the New York State Office for the Aging and authorization to contract with Lifespan of Greater Rochester for the Medicare Improvements for Patients and Providers Act.
Moved by Legislator Morris, seconded by Legislator Brew. Is there any discussion? Hearing none, all those in, I'm sorry. Okay. Hearing none, all those in favor, please signify by saying aye. Aye. Are there any opposed? Item carries. Next item, please.
Referral 23-0039, acceptance of a grant from the New York State Division of Criminal Justice Services for the Paul Coverdell Forensic Science Improvement Program, Office of the Medical Examiner's Forensic Toxicology Laboratory.
Moved by Legislator Brew, seconded by Legislator Smith. Is there any discussion? Legislator Smith.
What are the current wait times, and have they improved with the new position grades and bonuses? And will this further help wait times?
Through the chair. Currently, I can't speak to the wait times of the medical examiner's office as a whole, but in terms of the toxicology laboratory, it's less than 2 months. So I would consider that an improvement even since last quarter. And this grant perennially helps keep us afloat and keep us moving and keep our turnaround times as low as possible because it supports various aspects of what we do.
Great, thank you so much.
Yes, Legislator Blankley, please.
Question through you to the administration. There's a reduction in the funding from the state this year. Is that consistent with a trend? Is there an explanation for that? I'm just curious to learn a little bit more.
Sure. Through the chair, I really can't speak too much to that either, but I can say that it's based on federal funding that's available. So basically, the federal government releases a certain amount of money to each state every year. And then the state evaluates how many eligible laboratories it has and essentially divides the money among those. So it's just based on what the state had to sort of pass through this year.
Thank you, Mr. Chairman.
Further discussion? Legislator Brew?
Through the chair, it's usually continuing education programs such as postmortem interpretation courses and conference type activities, but a lot of week-long trainings, which are part of our new hire program, as well as, like I said, continuing education, which is part of our accreditation requirements. So for the most part, it's not in-house. But some of them are available online and some are not. So it's kind of a mix of both. Through the chair, people would attend there typically, yes, like from a site on the lab or in the lab, but it's not actually training that's broadcast from our laboratory. It's input to our laboratory, if that makes sense. Through the chair, if I understand your question correctly, I would say both. So, for example, I have board certifications. So part of the requirement to maintain that is to have a certain amount of continuing education every year. And whether I attend a webinar in-house or attend a conference, those both qualify. Through the chair, because of the new equipment? Through the chair, yes, staff would get credit if this continuing education was used as part of their training program.
Any further discussion? If I could just ask a clarifying question. It does seem like 2 months is quite good, and I fully appreciate that speed isn't necessarily your objective, but do you have a target throughput time that you're trying to achieve?
Through the chair, our target is to stay under 3 months.
Under 3 months?
Because that is And I base that on medical examiner guidelines. So the National Association of Medical Examiners recommends that 90% of cases get finalized within 90 days. So we aim for that so that we're not holding up the medical examiners. When the opioid crisis hit, we were overwhelmed and we weren't maintaining that, but we have been lately.
Okay.
So if that makes sense.
No, it absolutely does. I mean, the good news is you have a target you're tracking to, and it currently looks like you're doing a fair bit better than that. So looks like the additional equipment was helpful.
Thank you very much for that.
Thank you. Any further discussion? All right, hearing none, all those in favor signify by saying aye. Aye. Are there any opposed? Item carries. Next item, please.
Referral 23-0040, authorize a contract with National Medical Services, DBA NMS Labs, to provide toxicology laboratory services for the Monroe County Office of the Medical Examiner.
Moved by legislator Smith, seconded by legislator Dondorfer. Are there any questions? Legislator Smith.
Administration, why is an NMS Labs a sole service provider?
Hey, good evening. Bob Zerby from the Medical Examiner's Office. Through the chair, NMS was considered a sole source when we evaluated other laboratories that are able to provide this level of forensic toxicology service. We've used them consistently. They've met our needs consistently, and they seem to be the best game in town.
Thank you.
Further discussion? And all those in favor signify by saying aye. Aye. Are there any opposed? Item carries. Next item, please.
Referral 23-0041, authorizing any municipal agreement with the City of Rochester for Flower City Public Health Corps members to serve in the Monroe County Department of Public Health.
Moved by legislator Dondorfer, seconded by legislator Morris. Is there any discussion? Legislator Dondorfer.
Chair, to the administration, is there any liability exposure to the county due to this proposed IMA? Not a hot potato.
Through the chair, these individuals, as Dr. Vels de Brown can explain, will not be county employees. They are AmeriCorps members. We will enter into a contract, as we're asking this honorable body to approve an IMA with the City of Rochester. They're assigned to the City of Rochester through AmeriCorps. In our contract, we will include our standard language, minimizing the county's exposure to all extent possible.
Thank you. And just through the chair to the administration, then, is there any financial cost to the county in this?
Good evening, Dr. Velez de Brown, Deputy Commissioner of the Monroe County Department of Public Health. The beauty of this agreement is that the City of Rochester will be paying their AmeriCorps volunteers, and there is no cost to our department or the county.
Great. Thank you. And through the chair to the administration, describe how this is this going to be beneficial to the Department of Health then?
Through the chair, absolutely. These volunteers are folks of varying training levels who have an interest in public health. So that could be college students taking a gap year, recent college graduates. And we actually have had one fully licensed, trained, credentialed nurse who has expressed an interest to come volunteer with our department through this program. So it will absolutely benefit our department and kind of building up all of our programs to try to achieve pre-pandemic levels again.
Great. So through the chair to the administration, then, any idea how many people will be participating, or is it too early to tell?
It is too early. Through the chair, we haven't been told how many volunteers we might receive yet.
Great. I have no further questions. Thank you.
Thank you. Any further discussion? All those in favor, please. I'm sorry, Legislator Burr. Sorry.
Chair of the administration, with the volunteers that are coming into the program department, would that affect the Monroe County Youth Program that has just recently released the applications for youth? There's a group 18 and younger, 16 and younger come in and work for various county departments. You may or may not be familiar with that, but I know my daughter participated in the county health, this was probably 15 years ago as a summer.
Legislator Burr, I'm sorry, could you swing the microphone around, please?
Yeah, through the chair, I believe your question is, will this program, is this distinct from kind of the summer help type program
Well,
through the county?
No, let me clarify. I realize through the chair of the administration, I realize it's distinct and that there are two separate things. My question is, with the volunteers that are coming in to our Department of Health, would that negate the need for summer employment through our annual youth employment efforts?
Through the chair, no, there is plenty of work to go
Okay.
around.
Thank you.
Is there any further discussion? All right, all those in favor, please signify by saying aye. Opposed?
Referral 23-0042, amend Resolution 168 of 2021 as amended by Resolution 66 of 2022 to increase the amount of the contract with Tribe Ecotherapy for the provision of a mental health program as a holistic option for veterans struggling with mental illness for the Monroe County Veterans Services Agency.
Moved by legislator Morris, seconded by legislator Brew. Is there any discussion? Legislator Morris.
Yes, thank you. Through you, Mr. Chairman, to the administration. How are participants being chosen for the expansion of this program?
Nick Stefanovich, Monroe County Veteran Services. Through the chair, the recruitment effort is done through a variety of ways. The VA is involved. There are therapists that refer clients to the program. The Vet Center refers clients to the program. Tribe also does events out in the community. They'll set up tables at different events to advertise and communicate what they're offering. So it's a variety of means.
Thank you.
Further discussion? All right, all those in favor signify by saying aye. Are there any opposed? Item carries. Next item, please.
Referral 23-0059, acceptance of a grant from the New York State Department of Health for support of the Monroe County Nurse Family Partnership Program.
Moved by legislator Brew, seconded by legislator Smith. Is there any discussion? Legislator Brew.
Yes, through the chair of the administration. The funding only goes through March, I see. Will you be coming to us again soon to authorize additional funding for the rest of the year?
Through the chair, you've already authorized additional funding through the rest of the year. This is an extra that we get every year, well, most years. It comes to us around mid-February, and then we scramble to get it to the legislature so that it can be approved, and then we scramble to get it spent. We already have a plan for it. It will go to pay for some existing contract vouchers that we already have.
Okay. Thank you.
Further Legislator Hassman.
I was curious.
Through the chair, we do have data. It's a little difficult to extract because our data reports go into the national data system. And so we are able to produce some data locally, manually. And so if there are some specific requests for data, I would ask that people make those requests to us, and we will do our best to get that data back to you. Through the chair, yes.
Further discussion? All those in favor, please signify by saying aye. Are there any opposed? Item carries. Next item, please. Moved by legislator Smith, seconded by legislator Dondorfer. Is there any discussion? Legislator Smith?
Through the chair, I would have to get those numbers to you, but I will get them as soon as I can.
The referral states that this is the last year of potential extension for the grant. What would we need to do in the future to keep this program running?
Through the chair, that is something that we are considering. I know that the Veterans Court itself has put in an application for a grant, and we're looking towards other funding. I believe the worst case scenarios that Veterans Outreach Center has already agreed to pick it up, but stopping the program is not an option. So we'll have something.
Great. Thank you so much.
Any further discussion? All right, all those in favor signify by saying aye. Are there any opposed? Item carries. Next item, please.
Referral 23-0061, acceptance of funding from the United States Children's Bureau and Office of the Administration for Children and Families through a subcontract with the University of Connecticut for improving systems and implementing interventions to support lasting reunification of families.
Moved by legislator Dondorfer, seconded by legislator Morris. Is there any discussion? Legislator Dondorfer?
This program is affected.
Through the chair, it is projected to serve 24 children a year. At this point, we have run 2 cohorts, and I believe we're at approximately 10 children.
Great, thank you.
Thank you, Mr. Chairman. Through you to the administration, checking for further clarification, the money that will be used for outcomes for children and youth in foster care, is this already anticipated money that will be used to support existing planned services, or is this for additional?
Through the chair, these dollars were utilized to create a pilot of additional services.
Are those, and follow up through the chair, are those determined yet, or is that something still in process?
Through the chair, the program design has been completed, and we've begun running children through the program. There's been 2 cohorts so far.
Any further discussion? Just ask a clarifying question then. Pilot program, is this grant anticipated to be renewed at some point? And what would be the funding stream to continue this if you decide to?
Through the chair, the grant is for the next 3 years, and based upon outcomes, there is potential for grant renewal, is our hope. If not, we will look at our resources internally. There's the potential of funding a program like this utilizing preventive dollars, in which case we'd need to budget 38% local dollars to support its ongoing function.
All right, all those in favor, please signify by saying aye. Aye. Are there any opposed? Item carries. Next item, please.
Referral 23-0063, authorized contracts with Finger Lakes Performing Provider System, University of Rochester Medical Center, and Rochester Regional Health for Monroe Community Hospital to participate in the complex care program.
Moved by legislator Morris, seconded by legislator Brew. Is there any discussion? Legislator Morris.
Yes. Through the chair to the administration, is there an end date for these contracts?
Through the chair, the contract can last as long as FLIPS is willing to fund the program. So we have not specified an end date. If for any reason the county ever wanted to get out of the program, there will be an option for us to terminate the contract.
A follow-up question through the chair to the administration. We recently enacted this outside of Monroe Community Hospital. Has this been implemented yet? And if so, are we seeing encouraging results?
Through the chair, when we discussed the program broadly with FLIPS, they did indicate that they felt the program was successful outside of MCH. We have already at MCH been doing our part in accepting and admitting individuals that have complex needs. So we really just look to supplement what there's already been done.
Thank you. No further questions.
Senator Houseman.
I feel MCH offers an incredible service to our community, and I'm just so excited to see they'll benefit from the complex care program, and I can't wait to hear how the program progresses at MCH. So thank you.
Thank you. Any further discussion? All those in favor, please signify by saying aye. Are there any opposed? Item carries. Are there any other matters to come before this committee? There being no other matters, the February 28, 2023 meeting of the Human Services Committee stands adjourned. The next meeting of the Human Services Committee will be held on Tuesday, March 28, 2023 at 5 p.m.